Welcome to the Flex Health podcast with myself, Matthew Booth, and I'll let you introduce yourself.
Oh, thank you very much. My name's Alex Chester, also part of Flex Health.
And today we are going to be talking all things aches and pains. So, if you're new to this podcast, the format is that I will be asking Alex some questions around aches and pains. So, should we get into it?
Yeah, why not? Let's get started.
Cool. So a nice little bit of conversational pace. I'll start with the first one. So just from your experience, really, and kind of things you've done over your past, obviously working as a physiotherapist for many years, what would you say are the main causes of pain at work?
Well, to be fair, there isn't one. So I think it'd be very contradictory of me to pinpoint one thing. I can tell you the two most common injured areas. So we know that lower backs and knees are generally the areas of the body that give most people concern at work, most reasons for taking a bit of time off or just struggling through sort of day-to-day working life. But yeah, it would be lovely if there was one root cause that we could go to every time we assess someone. But if we look at backs and knees, probably any area in the body, that's just sadly not the case. It would be very nice if it'd be lovely if every one of our patients came to us and this is why your back's hurting, this is what we're going to do, and it was a nice success story. But yeah, it's just sadly not the case. So.
And why do you think, from your experience, why do you think it is backs and knees, sort of what you class as lower body versus kind of upper body injuries that you see more of in the workplace?
Very good question. I think they're the most common injured areas anyway. So, if we do look at where we do sort of experience aches and pains, it tends to be knees and backs, maybe because of the role they play in certain sort of scenarios and certain jobs. We do know that sitting is sort of bad for general health in general.
Yep.
So if you're sat for a period of 8 hours a day with minimal breaks, not getting up too much, we do know that your back's going to start to be angry. We do know things like being sedentary does lead to things like obesity, being overweight. And again, without getting sort of too technical, it's not just the forces that are going through our body when we do put on a bit of weight and a bit of size. Because that'd be, again, a contraindication. The amount of times we see a patient with bad knees and we say, right, do some strengthening stuff, put even more force through your knees. So that just doesn't make sense. And as we mentioned yesterday, the really good topic, really good research paper highlighting that obese people don't walk on their hands.
Mm-hmm.
Really nice question.
Nice, yeah.
But it highlights that people who are overweight, people who are sedentary or obese have more arthritis in every joint in the body.
Mm-hmm.
I'm rambling a bit now, but come back to that original question. Your knee is probably it is the biggest joint. So it's a huge... it is one of your biggest joints. So, them inflammatory markers are going to drift towards that area. There's more connective tissue. There's more things that can become aggravated in that area.
Yeah. And I guess when we're sat down right, they're probably a joint that we bend, we don't move. So,
exactly.
It becomes stiff and
yeah, 100% good point, because movement is how every joint in our body lubricates itself. It's how we pass fluid between cells. It's how it passes nutrients, there we go, nourishes itself. So every joint in the body likes to move, and as we know, your spine isn't one big bone. It's a series of joints, right and left, every vertebrae. So again, it needs to move. It likes to move.
Yeah, and I guess from my experience as well is I think we do tend to potentially change position a little bit more through our spines than our knees. Just from even when I'm sitting here now, I'm kind of rocking forwards and backwards a lot more than I am just bending my knees. So when I go to actually fully extend my knee, it does sometimes feel a little bit stiff. So, cool.
Yeah. And again, back to that sort of original point about the main cause, again, specific to lower backs, we know that 90% of lower back pain is non-specific. There is no one root cause. It's a contribution of many factors. Some psychological, some physical. And I think as physios, I think it's sometimes hard to get your head around, and a lot of physios still fight against the research that's coming out. They still fight against that. Well, there has to be a root cause. There has to be mechanical back pain. Has to be this one root cause. It's this facet joint that's causing the issue.
Yeah, absolutely.
It's because that muscle isn't working properly, which again is just not supported.
Yeah,
it's
yeah.
a good theory.
Yeah.
But there's no evidence to back it up.
And in terms of kind of sort of the kind of coming back to that question of what's the main cause of pain at work, I suppose trying to maybe offer a little bit of a solution just to the question. Say if somebody is listening and they are experiencing pain at work, what are some simple strategies that you could implement very quickly that, you know, if you don't go and see a physio, what are some simple things listening that they could implement at work if they're sat at a desk, for example?
So moving more is just something that's really, really simple. Again, I urge everyone, whether they're responsible for employees or it's an employee in pay themselves, just to be allowed to move that little bit more. I'm not advocating clearing off and doing laps of the car park and taking a 15-minute break just to move.
Yeah.
We can accomplish things by just having a quick 30 seconds lap of the office, going to get a drink, things like that. And again, as far as performance at work, you know, taking these small, regular mini breaks can not only improve your physical health, but your concentration span and everything else. That comes with
performance.
your performance at work. But again, you can't get away from the benefits of just exercise. You know, we don't mean specific planks, core bracing. All them days are sort of going with, especially with lower back pain. But yeah, just being more active, going for a 30-minute walk on a night. You know, substituting 30 minutes of EastEnders or Corrie for a walk.
Yeah.
You know, it's so simple, but very hard for people to do and break that mold of just putting the kids to bed, having a cup of tea and sitting on the settee.
Yeah, it is, absolutely. I remember someone once said to me when I was trying to advise them to go for a walk more, and they said, well, where am I walking to?
Yeah.
And I was like, well, you know, the point of it is just to go for a walk. You don't have to walk anywhere, but I think quite a lot of people's mindset is that they need to go to walk somewhere, whereas see it more as the exercise itself is what you're trying to achieve.
Yeah.
So yeah, absolutely.
Going a bit off topic there, I actually saw something about he's a dog walking expert actually, and he said about how dogs pull on the lead, and it's usually because it's us that if we're going for a 40-minute walk, or we usually go for distance, we do a lap of the park or we do a lap of the block, and we try and do that as quick as we can. So rather than if you look at when a dog walks, it likes to sniff, its senses are heightened, it likes to take its time. So again, I guess my point is, you know, you don't have to have a set distance. You don't have to walk out the house, see where your feet take you and go back.
Yeah, nice. Yeah, just allow yourself that. And it's good for well-being as well, isn't it? You know, I know this isn't about mental health and emotional health, but, you know, there's a significant amount of evidence to suggest that walking is not only great for our physical health, but just for our psychological well-being, for our emotional well-being. It all ties into one, doesn't it?
Yeah, absolutely. Some of my best ideas just going for a walk.
Yeah, absolutely. Great. Okay, so the next question that I've set you is sort of quite a broad term, but in your experience, why is it that there might be some potential conflicting advice, and, you know, why is it that in your experience other physiotherapists sort of don't like prescribing, or I'll be brutal, don't like prescribing sort of the more general kind of health and things like that, really?
So again, I think, so like I said in the previous question, some physios do hate that single track. Hate the fact that it can be general and there isn't one answer.
Yeah.
I guess probably comes down to a combination of a few things. Like the reason we get into physio is because we want to help something. Mm-hmm. We do like it that A plus B equals C.
Yeah.
And again, I think that goes across medicine. We do like a diagnosis, because I think there's that conflict of once you have a diagnosis, you know what you're playing with.
Yeah.
But again, with lower back, the diagnosis can be that there is no diagnosis. We have to
absolutely
take a little bit of that and a little bit of this, and together we'll formulate why your back is hurting.
Like a jigsaw, right?
Like a jigsaw, absolutely. I used to be very much the old approach. I used to be very much single track minded. Let's blame this facet joint at this level, L3, L4,
Absolutely.
on the left-hand side. That's why your back's hurting.
Yeah.
Because when you move there and when you twist a little bit, it hurts.
Yeah.
So in your mind, it sort of makes sense. Or, we like to blame it on that inactive glute.
Yeah.
And again, I trek that way, and I trek that way with success, which again is another conflict. Like, there's a great visual got put on Instagram the other day about you can have option A and option B, and they funnel in and come to the same result. Which is again why people ask, why does it matter? And to me, I guess it's because you can be promoting, unbeknown to yourself, negative health beliefs.
Yeah.
So if that one person truly believes that their glute med isn't firing properly and that's the reason that their back is doing too much work, I mean, that's all well and good, but again, we know that there isn't the evidence to support that.
Yeah.
And when we talk about evidence, it's not just the single case studies, because we can prove pretty much anything. But if you look at the studies, they're done on rats or rabbits or pig spines.
Mm-hmm.
They're not translated to humans. So yes, we can use snippets of evidence to try and promote anything. But as a general rule, which is why it takes so long for anything in physio or medicine to catch up, is 10 to 15 years, because you need a comprehensive case study. You need them comprehensive longitudinal studies. You need then at least 10 to 15 of them to do a comprehensive systematic review of what everything says. So yes, if we, you see it all the time, especially in like diets, and people say, carbs are bad for you, or this one food is responsible for this one protein, or this one carcinogenic that leads to cancer. And it is just a poorly done study. I think, and it isn't until you collect everything together that you get a full holistic answer. And with lower backs, the holistic answer is there is no one answer.
Yeah, and I think I had a situation the other day where, kind of coming back to your point of, are you one of the reasons about being is it important? Well, yes, it is, because I had a situation the other day when I was treating a patient, and they came in with a flare-up of their low back. And ultimately, it was stress. That was the reason that once I unpicked everything around what was going on, it turned out that ultimately, when it boiled down to it, they were going through a really stressful time at work. And I started to ask questions about that. And the end result at the end of the session was much more beneficial, because they could reason in their head that, when they do get stressed, the byproduct of their stress is that their back does flare up. So when I kind of highlighted that to them, they were like, okay, maybe I do need to try and relax a little bit more, or take some pressure off myself a little bit more, because I'm going to get those, her stresses manifested in a physical presentation.
I'm sure that's better than thinking we're broken.
Exactly.
That's better than thinking something is mechanically wrong. Like, I hate it when they compare us to cars, because we're nothing like machinery. So how do you explain that to patients then? So I know how. How do you explain that?
So I think first and foremost, when they walked in to the clinic room, they'd I'd not seen this patient for maybe 6 months. They had previously seen me for a low back issue. We had addressed the issue. We had gone through a very rigorous strengthening program, and they did have a very successful result. They then got back in contact with me, got them into the clinic room, and we just started to, I first and foremost asked around what she was doing in the gym. Had she changed anything? She did admit that she had perhaps gone backwards a little bit and was not at the physicality level she was before, and she just started to increase that. So that was, again, one potential root cause. But then I started just with the relationship that we've got, ask her about how work was going, and she then started to tell me that work was pretty stressful, that they were going through a lot of organisational change, and she was taking a lot of work outside of that 9 to 5, and it was creeping into the 7, 8s, 9s, PMs. And she was just finding that sleeping was becoming then an issue, because she wasn't getting enough sleep. Quality had gone down. And it just started to materialise. It was this waterfall of events that X, Y, Z, and not in that linear fashion, but just there was this much bigger underlying process. And, probably looking at it, and as I talk now, the biggest thing was that her work was impacting her sleep. She wasn't getting enough sleep. So then what we know is that when we don't sleep as well, that our ability to handle pain then diminishes, and this big compounding effect was happening. And at the end of the session, after we talked that through, she just sort of said, that's a massive weight off, I now understand what's going on, and she can actually affect change in her life, rather than you saying, well, they walk out and they just think that their glute med is under firing. And how can you really... It's not very tangible, that, is it? Because how do you know, other than objective testing, if somebody's glute med is actually... I know we're getting a little bit deep now in physio world, but... it was just a much nicer conversation to have around her general health and well-being, rather than just this one specific thing.
Yeah, you do raise a good point, because it is almost impossible to say that muscle is under firing, because one, it's covered by so many other muscles. This muscle that we're talking about, and if anyone's got experience with physios, you've probably been told that your glutes are asleep or your glutes aren't firing. So let's actually break that down a little bit. So there are so many muscles in and around the hip that mobilize and stabilize the hip. And again, most physios rely on their hands, so they will ask you to sustain a contraction. So they'll say, push against my hand, and they will then make a judgment call on how much force you can produce.
Yeah.
But again, it's the chicken or the egg. Are you unable to produce that force because you're in pain?
Yeah.
Because pain is an inhibitor. Mm-hmm. Pain will stop muscles working, which again is another reason we can be in pain.
Yeah.
And that leads to more pain.
Yeah, exactly.
Or are you in pain because that muscle can't produce force? It's impossible to say.
Absolutely.
And even if you think you understand what's happened as a patient, your memory lets you down. You won't remember what came first, no matter what you sort of tend to believe. You just won't. So I think that brings us to a good point now. So we've said that it's non-specific and there isn't one root cause. So what are some of the things that can actually cause? Probably best to talk about some of the things that can contribute towards back pain, I suppose, and knee pain.
Yeah, and I suppose that leads me on really nicely to the next question, which is, why does it matter? Which I guess we can kind of cover in that question. What within that, what causes low back pain, and why does it matter?
So I think we've sort of discussed some of the reasons why it does matter, because it's for me, it's we've gone through that stage where there are pros and cons to both paths. So ultimately, we are trying to get our patient better. Yep. So we're feeding them information, and that could be, it's this one area, and this is specifically why, and that might give them a trigger to exercise.
Exactly that. Yeah.
And again, our governing body, the Society of
Physiotherapy.
That's about our governing body then. So the Chartered Society of Physiotherapy, our governing body, and the HCPC, in our guidelines, we do have license to pull on previous experiences. Yes, we should be research-led. But I think that's becoming slightly demonised now. You only have to look at Instagram and social media. And there's a lot of people saying that past experiences and experience in this field doesn't matter.
Yeah.
When you look at any other field, I don't see that happening.
Yeah.
I mean, you don't see joiners. There might be new ways of putting wood together, but you wouldn't then see a young junior coming through. Challenging to the point where you're belittling them.
It's right to ask questions, right?
It is, yeah.
But experience is still important.
And again, it brings me back to the old point, I used to treat people with the whole mechanical, this is the issue, get this muscle working and your life will be better.
Yeah.
But I'm prescribing them exercises that's getting a lot of things working, and it's ultimately getting them moving. But in our human mind, we like to think that we're responsible for it. So I want to take credit as a physio because I've done my job, I've got some pride. And end of the day, he's come to me with 6 months of pain, and 6 weeks later or 12 weeks later, he's now not in pain.
Yeah.
So I must be the intervention.
Yeah.
But again, back to that original point, why it matters. I think the more experience I get is the more honest you can be with a patient. It does allow them to be less dependent on you and self-manage more.
Yeah.
Where if you think something's broken, I need to go back to the man who fixed me.
Yeah.
When sometimes just being honest and saying, okay, so when we're stressed, we are in a heightened state, and a really small pinprick will feel really, really intense pain.
Yeah.
And again, so I sort of always tend to explain that when we're heightened, when we're anxious, when we're stressed, our resting state in our body is ready to feel pain.
Yeah.
That's exactly the same when pain's been going on for more than 3 months.
Yeah.
We become heightened to that sensation of pain.
A really nice example I like to give in that situation is the difference between going out for a walk in the dark and the light. How much more anxious and aware of your surroundings are you in the dark than you are in the light, and you react with a much bigger reflex pattern. If, say, a dog moves or a cat moves when you're walking past them, you react in a much bigger fashion because your senses are much heightened. And it's the same for pain, isn't it? You react in a much bigger way because you're in pain. It is the same primitive response that, you are anxious because you're in pain, or you are heightened because you're in pain. It's the body reacting exactly the same way.
Yeah, no, absolutely. And there is still elements that, sitting for too long, it will put stress through our body and our joints will start to get aggravated. So it's not completely true on the other side to say that, okay, these joints in the back are giving us a bit of, and they're providing an inflammatory response which is causing our pain. Muscles that support the hip, support the back. If we're the people who tend to be deconditioned are the sedentary people. So again, is it because the sedentary and the joints aren't moving? Is it because the muscles are weak? Probably more the first one. But again, it is impossible to stay because you can't change one without changing the other. If you make someone more active, their muscles are going to become stronger. And I think just if you can get this message across to people that it's not because this one little area is broken or this one set muscle's not doing its job. I think it's just a much more positive way of looking at it.
Definitely.
And it gives them that more sense of control that I'm not damaged. I'm not ready for the junkyard. There's things we can do here.
Absolutely. It's your terminology and the words we use can be very damaging, can't they? So if you say to somebody, again coming back to the question, why does it matter? If a physio or a health practitioner is saying this area is damaged or this area doesn't work properly, then that's only phraseology that's going to be, it has connotations of, well, I can't do X, rather than what you're saying, which is I need you to be more healthy, and here's, in a less blunt way, and here's the reasons why. You can see there's two massive comparisons there between one leads to further potential inactivity, because they're gonna expect to limit things, whereas you're saying let's try and be as active as possible. There's no limitations.
There are not many injuries that require limitations. An open fracture. If you broke your leg, right, let's put a pot on it and let's worry about that later. But again, back to that original point of that you raised a minute ago about with maybe an orthopedic consultant, a surgeon, or someone else holding a scan in their hand and showing you the amount of damage. Again, when we bring that back to pain, we look at hundreds, if not thousands, of studies showing the relationship between a scan and pain, and there is none. Someone could have, on paper, the worst scan in the world, with all this arthritic change and this wear and tear and bone on bone, which is another topic that we won't get onto today. But again, and they could be walking around absolutely pain-free. They could be enjoying their life. They see that scan, the pain starts creeping in.
Absolutely.
Because we're very, very powerful in our mind. And vice versa. We could see someone on paper with minimal changes in the knee, in the back, in the hip, but they're in excruciating pain. So again, there is no direct relationship between what your scan is telling you and how much pain you're experiencing.
Absolutely. So just coming to the end of the podcast, and sort of one last question, and that question is, if the evidence kind of says everything that we've talked about, already, why doesn't everybody treat like in this fashion?
Great question. I think in a nutshell, it generally takes 10 to 15 years for something to become widely accepted and proven. And again, that just goes how medical research works. You need to perform little studies, you then perform a little bit bigger studies, you then have a whole load of big studies, and you can then analyse them all as a full review. So to do that process, each study maybe takes 6 months, potentially, some take 5 years if you're looking at a longitudinal study, even longer. So to get an out-and-out answer of what is true and what's not true, it can take 10 to 15 years. But ultimately, I think physio, medicine is never straightforward. I mean, look how complex what we're talking about now is.
Of course,
yeah. We're telling you that there is no root cause, but there are a few root causes.
And it might be quite hard to hear for a lot of people listening.
Yeah, it's very different for person A versus person B.
Yeah.
And there is still an element of making your rationale and using your clinical reasoning as a physio, and again, you might have two people presenting very, very similar with the pain, but their personalities are very different. So that also changes how you're going to treat them and the advice you sort of give. But again, we still use our past experiences, and like I said, our governing body allows us to use our past as long as it's not unsafe, as long as it's not deemed unsafe and completely disproven. We are still able to use our past experiences. So if you've had success as a physio of treating, 6 out of 10 people's lower back, and you might convince yourself it's a little bit higher.
Yeah.
But if you're convincing yourself that you're having that success rate that's more than 50%, why would you change?
Yeah, absolutely.
Why would you change your method?
Why would you question the status quo?
Yeah, exactly. And you're attributing what you've done. It's got John Smith back to playing rugby or back to the gym or just walking his dog, pain-free. And he's then referred to someone else.
Yeah.
So it's just that same route and that same method, I guess.
But I guess in the same kind of thing there is that as a healthcare practitioner and patients listening, and people listening, you still don't know what's happening in that time, right? So yeah, John Smith might be back playing rugby, but you don't know what less stress he's got going on in his life. But you may not have asked those bigger questions and those. We were on another podcast recently, and Joe, our friend, said meet someone where they're at, and be a little bit more of that lighter touch approach rather than being this is the out and out problem.
Absolutely. And if someone comes for a physio, you can guarantee you're getting sent away with some exercises.
Yeah.
So ultimately, you are going to advise to be moved more, usually, regardless of what your issue is. Mm-hmm. And it just proves that if we do move more, you're generally going to feel a bit better.
Yeah. Nice one.
Nice. Good.
Yeah, so if you have enjoyed listening to this more conversational pace around sort of the aches and pains in the workplace, Alex has done an actual webinar presentation which you can find on the FlexSelf app as well. So it's a little bit more detailed with a lot more structure to it. So there are two mediums. This is the podcast version, but Alex has also done a very detailed, specific presentation webinar on the aches and pains in the workplace.
Thank you very much.
Thank you.
Nice.